les sensicaires, on en veut 30 sensicaires.
A group of volunteer doctors and nurses prepare to leave Montreal on a medical mission to Burkina Faso in West Africa. The mission is carried out by Mères du Monde en Santé, or Healthy Mothers of the World, a charitable foundation headed by Montreal urologist Dr. Jacques Cocos.
Est-ce qu'elle a des fuites actuellement?
Boromo is a small town 2 hours from the capital city of Ouagadougou. Every year, the MMS Foundation medical team conducts 2 surgical missions at the Boromo Medical Center, which has an important vocation in maternal health.
During each week-long mission, the team treats 20 women from across the country who suffer from obstetrical fistula.
Des gens qui sont très éloignés de nous viennent à notre secours pour aider vraiment ces femmes qui sont souvent dans des états vraiment très déplorables.
Obstetrical fistula results in infant mortality and causes incontinence and social stigma for the mother.
In these countries, because of the lack of facility or lack of trained personnel, very often deliveries are prolonged for hours or days. Most of the time, these fistula are seen in people living in remote places, far from any medical centers, and far from any place where you can do a C-section. Another common cause in Africa is the young age of the mothers. Very often they get married around 13, 14 years old, at an age where the pelvis is not ready for a pregnancy and delivery.
Surgery takes place under difficult conditions. The hospital operating room lacks up-to-date equipment, proper lighting, and ventilation. The foundation plans to build a brand new operating room at the Boromo Medical Center. Your donations can help make this a reality. Every gift counts. The MMS Foundation has an excellent success rate. Thanks to a joint team effort, the majority of our fistula patients regain their health and return home to lead a normal life.
Voilà. Après l'accouchement, quand il y a eu les pérdules, parce que c'était normal, que ça allait passer quelques temps après. Mais quelque temps, ça n'est pas passé. Donc, ils se sont renseignés encore, on a dit qu'on pouvait soigner ça ici.
A majority of the women went back to with their husband, and even some of our women got a new pregnancies. So that's really good results.
This patient is probably around 65 or 70, we don't know exactly. And it's an interesting story because for 50 years, or almost 50 years, she never found the money or way to come to get her surgery for fistula. She waited 40 years for a surgery which is so easy and so short to do. And now she's cured. She's going back home. She's going to be dry for the rest of her life. And just this is a good example how things can be simple and easy sometimes.